Alright, so now we will learn how to do rigid taping for the knee joint. As we know, knee is one of the strongest joints of the body, and it is made up of femur on the top and tibia and fibula on the bottom. And this little bone called as the kneecap or the patella, which is right there, which facilitates the quadriceps mechanism. So yeah, that's how it looks anteriorly and posteriorly. You see the two tibial, two condyles of femur, and they articulate with the upper part of the tibia. Knee is also the joint that has the strongest muscles that pass through the knee joint. You have the huge quadriceps on the top, comprising of the rectus femoris, vastus medialis, and vastus lateralis, and intermedius is just beneath the rectus femoris, so that's about the top of the knee joint. Below the knee joint, you have the tibialis anterior and the part of the medial head of gastrocnemius. You also have the small patellar tendon, often also called as the patellar ligament, which attaches the lower pole of the patella to the tibial tuberosity. Posteriorly, again, the knee is tremendously supported with huge muscles on the top, which includes the hamstrings, the biceps femoris, semitendinosus, and semimembranosus. Below you have the gastrocnemius, medial head, and the lateral head. So knee is a tremendously strong joint. It is a hinge joint. It can move only in one plane, and knee is supported with 12 or 13 major ligaments. But since knee is a strong joint, it is a heavily loaded joint, especially in activities that require too much of jumping and landing, too much of change in direction at high speeds while running. So knee tends to undergo a lot of rotatory forces, and these are the damaging forces. So the knee is overstretched and it rotates. It tends to damage the anterior cruciate ligament, which is the injury which can keep the athlete out for 6 to 12 months, if not longer. On the inner side, it has the medial collateral ligament. So if there is a sliding tackle coming in, it kind of pushes the knee from inside and opens it up, so the MCL gets damaged, which is also the commonest knee ligament injury. So knee is at a high risk. It's a tremendously useful joint for sport. But it is at quite a high risk of injuries. So we've come across a lot of athletes who have different forms of knee problems. Some have MCL injuries, some have knee meniscal injuries, some have ACL laxities, and some have a combination of both. So the taping that we are going to learn today is kind of a comprehensive or an inclusive knee taping, which supports the inside for MCL, the outside for LCL, and it also supports for cruciates to avoid excessive rotational movements. Okay, so the way we start this taping is we first create anchors. So you see I've already applied the foam wrap here. One is beneath the inferior part of the knee and one is around the mid of the thigh. So what I'm going to do is I'm going to apply an anchor here. Because my athlete is nice and strong in his build, I will probably apply one additional anchor to make sure that I have enough grip of the other vertical slips of the tape. Then on the top, I'm going to apply certainly more than two. I'm not going to compress it much, although this is nice, soft, and area with a lot of pliability. So the risk of you damaging anything is very low, but you don't want to add to the misery of the athlete. So that's top anchor number 2. And that's top anchor number 3. So that should be quite adequate for what we are trying to achieve. So we have a bottom anchor and we have a top anchor. All right, and there's the knee joint here. There's the kneecap. I should have some understanding of the bony landmarks. So that's the lower end of the quads. That's the kneecap. That's the patellar ligament. That's the tibial tuberosity. So I kind of know the structural formation of my athlete so that I can decide the right approach to doing it. Now these anchors are rigid adhesive tape. In knee taping, what we do, we will now use the rigid elastic tape. All right. So the way we start is we will first ask the athlete to take the step forward, and that foot will go back and slightly flex the knee. Yeah, perfect. So that's kind of neutral position of the knee joint. And at this point, I'll also double use this tape and ask him to raise his heel and keep it on this tape. Yeah, so that kind of, yeah, that's a very appropriate position of taping the knee joint. Okay, this ideally I should be using a wooden block, but this roll of tape will do the job for me because I don't need it right now. So what I'm going to do, I'm going to start from somewhere around, so if this is the mid of the sideline, just behind it, I'm going to stick this here and I'm opening it. I'm deciding how much pull I want because this comes from a predetermined tension from the manufacturer. I may or may not need that. So I'll open it and I'll decide what I need, and then I'll cross over and stick it here on the, so I'm starting from the lateral side of the knee, I'm going to the medial side of the, superiorly, I'm going to the medial side of the knee inferiorly. Now what I'll do is, I'll start from somewhere around the center of the knee or maybe slightly from here superiorly. See, my crossing point is almost the lateral collateral ligament. All right, and I'll stick it here inferiorly. All right, then I'll put a straight slip, stretch it as much as I feel is appropriate, and I stick it here. So that kind of reinforces the lateral aspect. I'll do quite similar thing on the medial aspect. All right, I'll start superiorly outside, I'll bend it in, I'll finish it inside, then I'll start superiorly, slightly lateral to the midline, and I'll bring it in here. So this kind of reinforces the MCL. Okay, and the third one is going to come straight, just like the other side. Right. Okay, now if these guys are coming down, it's a good idea to take a layer of tape and apply a holding anchor. Okay, you can do the same here as well. If these guys are not coming down, obviously because we are doing it over the foam wrap, we are not getting the adhesiveness. If this was over the skin, trust me, everything will stick. Okay, now an interesting point to note here, we can do one more little tweak here because MCL is more commonly affected. All right, let's put one additional layer of support to the MCL using an adhesive tape. But as it passes, you see there's a notch here. There's a notch here. You see that notch developing? We want to stay clear of this. So what I'll do is I will slightly kink the tape there and then attach the tape here. Okay, so this is my additional support for the MCL, and the tape is kinked here, so even if the leg moves, this notch will not be rubbed upon by the edge of the tape. Okay, right, so we are now done for MCL and LCL. Now we will do a rotational stability thing. All right, so how do we do this? We start from behind, we go around and we stick it here. So that's one rotation. The other rotation, we start from behind, we go around and we stick it here. So this is going to give us rotational stability to protect the movement or support the ACL and the PCL. Okay, so once we are done, we can now apply a closing anchor on the top and one closing anchor below. I won't mind applying another closing anchor below because I want to support the patellar tendon or the patellar ligament, because as the knee moves this way, you will have the patellar tendon under stress. So I would want to get this guy additionally supported. Okay, that kind of helps. Okay, now what you want to come here and see is we have left the knee crease intact. So as the knee bends, this crease is intact. Okay, nothing will rub against this crease. So this is something that you have to keep in mind. The knee crease should be left free completely. All right. So with everything nice in place, this athlete now has an additional support to his knee. So we have a medial support, we have a lateral support, and we also have a rotational support. Okay. Yeah, so some movement is possible because we have used elastic tapes. Okay, but that movement is not possible beyond a certain range. And that is what we want to avoid, the extremes of ranges of movement where damage can be provoked. All right, good.